In this video, I'm going to go through how Xapimed can be used to help facilitate nurse career development. We'll start off by looking at a nurse transitioning from their current role to another that better aligns with their professional aspirations. We'll then see how a nurse can achieve these competencies, and then finish off with highlighting transparency to leadership throughout the career progression journey. Starting off, I'm currently logged in as a nurse Jacinta Kimberly, who is a level 1 RN working in the oncology unit. We can see her skills profile page detailing competencies that nurses with this job role need to have. Now, starting off in her career, Jacinta has come to realize that the oncology unit's environment is not for her. She's able to use Xapimed to do one of two things. The first thing is by having Xapimed identify job roles that she can transition to based on her current skills, experiences, and qualifications. After exploring the options, Jacinta finds that a level 2 RN infusion role best aligns with her current personal aspirations and professional goals. She can go ahead and add this to her personal benchmark, setting a clear goal for her career path. This provides transparency to her manager and supports them in facilitating her journey towards this new role. The second option is for Jacinta to go to her Xapimed catalog. By default, the catalog will show all competencies she's able to develop, supported by material the hospital has provided. Let's say she has grown ongoing interest in infusion therapy. She's able to filter the skills catalog down to this particular job role. This will provide specific competencies associated with this role and how they align with her current skill set. She's able to then add this to her personal benchmark after understanding what transitioning to this new role would look like. Going back to Jacinta's skills profile page, we are now able to see this new job role she is progressing towards under personal benchmarks. To begin developing in a competency, for example, performing a head-to-toe physical assessment, Jacinta can open it up. Under knowledge, she is able to review a list of reference materials which support the competency, and this could include required material she needs to review prior to verification. Clicking on skill, she's able to use one of the verification methods to achieve competency. For example, she may request a return demonstration checklist from a valid preceptor. In this case, she would select Jody. Alternatively, she also has the option to undertake a more structured approach by going through a development plan. This structured pathway would guide her through her competency step by step, helping her to build confidence and achieve competency over time. For this development plan, Jacinta will first review some support material, which includes watching a video, doing a brief self-assessment, or reading some policies. She will then attend a skills lab feedback session. Upon completing that, she will do a post-test, and that is followed up with a return demonstration with her preceptor. If she is successful, she will achieve competency and have to recertify after 1 year. On the other hand, if she is not successful, she'll go down a remediation pathway where her line manager will first be notified, and after receiving some coaching, she'll be assessed again. Now, to see the transparency of Jacinta's career intentions, I'm going to switch over to a nurse manager or leader account. In this case, I'm responsible for nurses in the oncology unit, and I have a dashboard showing me their competency progression. For this current view, I've set it to show me activity in the last 30 days. Immediately, I notice that Jacinta has made no progress at all in any oncology competencies signified by this grey dash icon on the top right hand corner of each cell. Clicking on her profile, I'm able to see that she has added a level 2 infusion RN role as a personal benchmark. To support her journey and career aspirations, we decide to prioritize a few competencies to help her with her transition. As part of the prioritization process, I also decide to assign a development plan to Jacinta. Coming back after a few weeks, I can see that she is currently pending verification. This means that she may be working with a preceptor on achieving those competencies. And then going to her history page, I can see that she is also well underway in her development plan.